It's another Saturday. Thanks for staying tuned to your station, the Africa Independent Television, and welcome to your program, Security Watch Africa. Only on this channel, we'll bring you that information you need to keep your life safe and secured. Welcome to the program today. My name still remains Patrick Abambo. We will continue from where we stopped last week. With me in the studio already seated is Dr. Emeka Kainebi, a public health practitioner who has been with us looking at the issue of coronavirus, COVID-19, and from on continuously, he will be with us every week to look at what is happening because a lot of people are getting worried. But before we come to Dr. Kainebi, I want to say that I was online because early this morning I was woken up by some people who were making inquiry about what was happening in Ondo State, precisely in Ilu Abo in Ondo State. I had to get across to. I got across to the Commissioner of Police, CP Unde Adie, to find out what really is happening, and he did told me that there was a company, King Rocks, in Edo State, that got permission to move some explosive. They are into quarry business, and the armory is in Ibadan, and they were transporting from Ibadan to on Edo State, passing through Edo, and they needed escorts. Of course, the only agency of government that can escort such is the EOD department of the Nigerian police were escorting. Along the line, the vehicle carrying this explosive developed some faults, and as we are trying to look at what the solution is, and that was where the fire started and the explosion everywhere. It's sad that some people got injured, that particularly some security officers and the driver and his assistant, and hundreds of properties destroyed. But we thank God that no life is lost, and police have taken charge of the environment. We hope that things will be well managed and that. Then secondly, I want to also say that during the week, the news of the attack on our gallant soldiers in Ganiri in Yobe State and Gobi in Borno State, where 29 officers and soldiers were killed. It's sad that at this period where the whole world is in pain, that these insurgents are not resting. About 32 other officers soldiers were injured. But the good thing is that the Chief of Army Staff stepped in and made sure that those who were injured got all they need to make sure they get back on their feet. And you can see a lot of things were provided. He visited the Major General Udo and the Major General Samuel Adebayo were there, making sure that those who were injured get back on their feet quickly. We must say that I expect that even this Boko Haram or whatever they are should have even rested at this time. But anyway, but seriously speaking, I think that communities must get involved, because the true situation of what happened in that incident, after the gallant officer has succeeded to liberate those communities, they were preparing early morning to advance to another location, and when there was this surprise attack at the rear guard, attack on the rear guard, that actually what happened. We expected that some of these communities should have given information to security agencies. I don't know what happened, but no information was given. But it's sad that Nigeria lost gallant 29 officers and soldiers. It's very, very sad. We hope it will not happen again, and that is what the Chief of Army Staff has said, that officers must make sure they don't lose their guard any longer. Also, just yesterday, it's so sad, really, a personal friend and a man who had been working so gallantly to ensure that Nigeria is safe, particularly last year during the electionary campaigns of the President Muhammadu Buhari. He led the patrol, he led the escort all through the Federation to ensure that the campaigns were hitch-free. Talking about ACP Abdullahi Ibrahim, who is the commander Mopo 54 in Onitsha. Sadly, he lost his life yesterday, along with his wife, in a ghastly motor accident. It's so sad. He's an Africa Security Watch Awards recipient for the marvelous job he did all through. He was in charge of the presidential escorts all through for almost 2 years. He did excellently well. We sad that we lost him and his wife. His 2 children were injured, still in the hospital. We pray that these children will get back and get fit again. So sad that he died. Right now, he's being buried in his state, Bauchi State. But let's look at what is actually consuming us. Again, the Nigerian army is also getting prepared. Everybody must get prepared with this pandemic, this coronavirus pandemic that is everywhere. The Nigerian army has made sure that all their hospitals are up to date to ensure that in case there's need, that they will not be lacking. They must support the national fight against coronavirus. The Chief of Army Staff visited one of the hospitals. Sit back as we bring you this report by Shirley Daniels.
Staff Lieutenant General Toko Yusuf Buratai's vision of building a professionally responsive Nigerian army in the discharge of his constitutional role. The Nigerian army is ready to contribute to the fight against coronavirus COVID-19. As part of his readiness, campaigns are ongoing in all his barracks, formation and location to sensitize its personnel and families on coronavirus. The Nigerian Army hospitals nationwide are made ready to provide up-to-date services in case they are needed. One of these hospitals is the Army Command and Nawa Specialist Hospital in Abuja, which was visited by the Chief of Army Staff to assess its preparedness. At the hospital, the Chief Medical Director, CMD Major General Ikechukwu Okeke, retired, while conducting the Chief of Army Staff and his entourage round the facility gave assurance that more effort will be made to put the hospital in good state so as to be part of the national response on coronavirus.
So this section is the General Outpatient Department. We have
please maintain social distance.
Two consulting rooms. We have 2 consulting rooms, each with 2 desks. Then at this end is the dental clinic. We have 2 dental machines which to look in. So this is the physiotherapy department, still being set up to be able to carry out post chemical pathology, microbiology, and hematology investigations. We've got all the necessary equipment. That's the mammography machine. Then that's the digital X-ray machine, which we have close. Then these are the X-ray viewing boxes that will be mounted in different places. This is the labor ward, women that are waiting to go to delivery. So by the time they're due, they are willing to delivery room clinic. Yes. So we have 3-bed delivery room. So those patients that need further attention after emergency are brought into this is a substation room for accident emergency.
He also disclosed that the hospital is currently liaising with Nigerian Center for Disease Control, NCDC, to ensure that necessary guidelines in the prevention and care of COVID-19 are followed in the facility. According to the Chief Medical Director, the Army Command and Nawa Specialist Hospital is designed as a standard general hospital with almost all the departments located within the enclosed blocks. This ensures that most services can be obtained without stepping out of the buildings.
Another private ward, and this is the doctor's call duty room. This single bed private room, similar to the. This is also. The entrance to the emergency is through here. Vehicles bringing emergency cases up here. They come in here. We sustain them and try them in this cubicles.
In his remarks, Lieutenant General Toko Yusuf Buratai tasked the CMD and pioneer staff of the hospital to be committed and dedicated in offering quality healthcare services and treatment to prospective patients. The Chief of Army Staff expressed delight over the state-of-the-art medical facilities already on ground for the smooth takeoff, assuring that more funds will be made available to provide other critical amenities for the specialist hospital. The hospital building consists of 2 blocks of 1-story building. It has provision for a reception, general outpatients, children clinic, general and private ward, pharmacy, and radiology. Shirley Daniels, Security Watch Africa, Abuja.
Welcome back. If I was quote, my guest in the studio, who is a medical practitioner himself, he's quite impressed with what you're saying there.
I am. I'm just waiting for the staff who are going to be there, you know, and work there.
Also very seasoned.
Exactly,
anyway, I'm sure of that. Proper utilization of the equipment.
And maintenance of equipment as well. That's very critical.
All right. Yeah. We also decided to find out before we start our interaction here in the studio, to find out from Nigerians on the street their understanding about coronavirus, this COVID-19, because the awareness is going on every day, but do people actually know what it's all about and the implications? So sit back as we bring you this report by Peggy Agbe.
Coronavirus COVID-19, which has been declared a pandemic by the World Health Organization, WHO, because of the magnitude of its spread and deaths associated with it worldwide. Manifests with symptoms like common cold, running nose, more severe symptoms including high fever, cough, shortness of breath. The pandemic, which has put millions of people and countries across the world on lockdown, is increasing by the day. Currently in Nigeria, 81 cases, 1 death confirmed, and 3 persons recovered and discharged, according to the records from the Nigeria Center for Disease Control, NCDC. Unlike earlier, when some Nigerians believed that the pandemic was a political propaganda, the tone has changed, as lots of Nigerians now advocate for safety measures to be taken seriously. Security Watch Africa crew took to the streets to find out how much people know about the virus and ways to prevent its spread, and they have these to say.
Yeah, you can see all around people are using masks, using hand gloves and whatever, to the best of their ability to curtail the spread.
What are you doing in your own little space?
And actually, I used to sanitize my hands and all other things that it entails. I follow it strictly.
I'm happy the awareness is very high. People have been greatly sensitized. As you can see, we, the residents of Abuja, we are also really prepared. You can see I'm having my sanitizer attached to my bag. I also have my face mask. And I'm happy because the FCT minister and also the Minister of Health have done enough. And we, the healthcare workers, are also doing our own bit. We're happy that people are really complying. And also, as you can see, the street of Abuja is almost getting closed because people are ready to buy things so that they can keep in their homes in case if there is a total lockdown. My happiness is that everybody is scared, everybody is alive to fight the disease. So let us put our hands together, whether you are rich, whether you are poor. COVID-19 is not a respecter of any human being. So please let us come together and fight it.
To my best of understanding, I think government need to put some certain things in measure. Like provision is not actually made for people right now. And you don't expect them to just shut down like that.
What kind of provisions?
At least they should give people a kind of a minimum of like a day or 2 for them to go to the market and get 1 or 2 things. I was just coming from the market now and I just discovered that most of the markets are locked.
Maintaining the social distance as recommended. And then 2, getting my hands sanitized. I also see another alternative as wearing the nose mask. I personally don't really fashion it because a lot of persons that are wearing it not well informed as to how they should wear it. But I think another thing is the gloves too. But intermittently, when you wear all those things, there are time frames for which you should dispose them.
Basically, I think every Nigerian should just observe the safety measures. Wear your gloves and then wash your hands regularly, wear your mask and maintain a healthy hygiene.
With the myth of speculations that gargling water with salt or vinegar, consuming alcohol, bleach, or cleaning liquids, and the use of chloroquine as a means of preventing the virus, the World Health Organization and the Nigerian Center for Disease Control have said that all these are not ways of preventing the virus or treating patients. As a way of reducing the rapid spread of COVID-19, it is important that all possible measures geared towards protecting lives of citizens is encouraged by all. Let's stay safe. Peggy Agbe, Security Watch Africa, Abuja.
Welcome back. Yes, if you're joining us, this is your program, Security Watch Africa, on this channel, Africa Independent Television. I still have in the studio with me, Dr. Emeka Kanebi, who has been looking at issues. We've been interacting quite frequently on what is happening in Nigeria. Now it's for him to come, but you can join us through the social media platforms that are on display on the screen so that you can communicate with us, our Twitter account, our Facebook page, and through emails. Communicate with us so that we can interact with you. Let me come to you, Emeka. Last week, as at the time we were on the program, it was less than 40
yes,
confirmed cases in Nigeria.
Yes.
Today is, as this morning, is 81.
81, yes.
What is happening?
So it's actually, well, I would say that this is not unprecedented. We expected this to happen. The more contacts of index cases are being located or begin to show signs of the infection and are being tested, we would eventually get to see a rise of the cases. All right, so this is not unprecedented. However, the government and basically other countries, equally Nigeria, are putting measures in place to curb this exponential rise in the numbers, because that's what we're seeing. Yeah. We're not seeing, more of, 1 to 2 or 3, but we're now seeing jumps, leaps in the numbers. So basically the prohibiting or restricting movements and restricting the social distancing and then the stay-at-home order, all of these are interventions or measures to curb the spread of the infection. If these numbers keep rising, what happens? The greatest fear is that the health facilities of the 20% that would need intensive care would rise.
Will rise, exactly.
And if that rises, our health system becomes overwhelmed. And if that happens, that's where the problem comes. So,
because,
go ahead.
Because in the United States, for instance, about 4 days ago, they were the number 6.
Exactly.
Today, they are the leading in terms of and their hospitals are overwhelmed.
Exactly.
The governor of New York City was crying that they want to construct makeshift hospitals and all that.
Because that's the challenge, and that's the fear for even countries, developing countries like Nigeria.
Like Nigeria.
Exactly.
The president of Nigeria have said that stadiums can also be converted.
I saw that in the news, stadiums, and I even saw NYSC camps as well.
NYSC orientation camp.
Yes.
Lagos State, for instance, Nicol Stadium, they have constructed an isolation center over there in partnership with private sector.
Exactly.
Will this help at all?
I think it's not a wrong step. Again, like I said, I think we're taking, even though we're doing this a little too late, I wish it had come earlier, but these things are basically just to ensure that we have places to isolate cases, to quarantine cases of contact and all of that. And because right now, if you speak to anybody from the NCDC, they'll tell you they're getting tons of SMSs, tons of calls, and messages as well, with people saying
some of them are prank calls.
Some of them are prank calls. Exactly, some of them are prank calls. And then what's happening again is that people are also calling to report their neighbors. Hey, I have somebody in my compound, he's coughing, which is not terrible, but again, it's just or some people are calling and they want to get tested. Just to make sure, everybody is really concerned. But we don't even have those number of test kits. And all of that. Yes.
Good. I think since you've talked about it, I think we also have some numbers that people can call across the Federation, if we can display it on the screen so that people can see every state in Nigeria already captured in this. There are phone numbers people can reach and Now, the issue about the testing, during the week, we had only 5 labs for testing. I understand that
we
in
have a
under
sixth
1
one.
week we'll
Yeah,
have add
exactly.
more 4.
Yes, yes.
So make it 9.
Yeah, exactly. There's even news of a 6th PCR lab. So a lab has come up, and then we're going to have more. That's excellent as well, because if we have more centers, because a country like Burundi had said that they hadn't had any cases, but they said it's because they don't have test kits. You know, so exactly. So I think the more that we have this, yes, we would be able to identify more cases. But again, this does not control the spread. It just helps us. Our numbers would definitely increase.
Yeah.
Yes.
But I will try to find out who should be tested. Should every citizen just go and be tested?
No. That's never a strategy of, you know, even in the HIV epidemic, that was an initial strategy, but now we're not doing that because it's not cost effective. Because in the population, not everybody will be infected, and the test kits don't come cheap.
Yeah.
Even though right now we have a lot of philanthropists, a lot of people are churning in money, which is awesome, and that is great, and I hope that more people who have can assist the country, especially the health sector, can come in and then ensure that we have enough test kits to have clients who are actually suspect cases, not just if you're testing the whole population, that would really be a big toll financially on the country. Already the country is already suffering an economic crisis.
But some people feel, look, they should, all their family members should just go and get
tested.
tested.
No. Their criteria to have all your family tested, their criteria to have you tested, and so those criteria have to be met, you know, before you just go testing the population.
I know, like in UK, the NHS says not everybody that should be tested. Many people called in and they said, no, sorry, it can't be tested.
Exactly, and it's now happening.
They were ready to pay, and they said no.
Yes, people are actually willing to, you know, pay, but you know, again, it's not even now about the money, but it's even about the availability. Because a lot of countries like Italy, Spain, these countries have a huge burden. Countries, yes, Nigeria, it's rising, but you know, so where
Still
are we going to still exactly? I think the most important thing is all the measures we've talked about here in the preceding weeks should actually be adhered to. In doing that, we definitely save a lot of the spread. We actually curb that to a great magnitude.
Okay.
Yes.
As a citizen of Nigeria and as a health practitioner, would you say that Nigeria is doing relatively well, or we're doing badly?
Well, I wouldn't go to an extreme. You know, Nigeria has never really done too well in the health sector. We have to wait for times like this. Think about it. Even countries that we have always admired
they all failed.
They've all in something like this. They've all shown how inadequate they can be. Trust me, we're not there yet. Even with the numbers of healthcare workers we have to attend to this crisis, and talk more of the facilities. We're talking about stadiums and NYSC camps right now. We just saw a new a center unveiled, and all of that. We aren't there. We aren't ready, but we're trying to step there in the right direction. Hopefully, it doesn't burden us so much that these systems become overwhelmed. Because go ahead.
I know some states that already have their isolation center ready, yet they're just waiting for patients to come.
That's what it is, exactly. And in most of these places, let's not forget, like we said, your burden is determined by how your case identification measures. If you're not identifying cases, it shows you don't have cases, but you probably do. And it's actually more dangerous because the spread might continue without people knowing. The good thing again is that a lot of people, viruses are usually self-limiting illnesses. So a lot of people actually get infected and recover without even knowing it's coronavirus. That's the amazing thing.
Okay.
But
that's what I wanted to come back. Before now, we used to have malaria fever, we used to have typhoid fever, and typhoid fever and coronavirus, are they not similar?
Well,
because
again,
does it mean that even if you have these sicknesses, can it just be coronavirus?
And that's another thing. Like I said, if everybody who has a fever, or anybody who fever, I mean here by a rise in temperature or a cold, reports to the NCDC and tries to get tested, will overwhelm the health system, overwhelm our health centers. So it's not just about that, because they have similar symptoms.
Yes,
So basically, it has to come to a certain point, and then their criteria, you can find that on the WHO website, on CDC website, also NCDC. There are even apps now the CDC have developed for you to actually put in your your symptoms, and it could tell you at what level you are, whether you should self-isolate, whether you should report to NCDC and all of that. And these are measures because everybody who's good, because trust me, malaria hasn't stopped because of COVID virus. As you can see, the world is going on. The bombings, the deaths, people, life still goes on. People, other diseases. Remember that we're not just dealing with
Lassa
COVID.
fever is still there.
Lassa fever is still killing people. So we're still dealing with all of that in this situation. So we just have to be careful with how much. But I must say that the media, and well done to your team and everybody on the Africa Independent Television, because and other media centers, because they've done so well in basically churning out the right information. So a lot of people, because like I told you, nobody wants to die, everybody wants to live. And so that information, basically people are doing so well. I go into the supermarkets and people are trying the social distancing, being very careful. And I think this is a good way. And staying at home as well, it's a good one. And not the panic. Remember, not the panic
because
buying.
I was going to, now we're getting signs to leave, but I just want to come back to that again, the issue about the panic.
Yes.
What lifestyle should we be living?
Exactly. So basically for now, yes, we know that a lot of markets, I can actually attest to Wuse Market and then Utako Market, they've been kind of some shut down, but not to food, and then medicines, which is excellent because then people need that to survive. And most people are stocking up on the same things, food and medicines. But these things are still available, so there's no need to rush to go get these things because these would be open until there's somewhat, and we hope we don't get there to a total lockdown. So these will still be available.
I
so
hope
people
we don't
need
get there too.
Yes,
it's a pleasure having you again.
Excellent.
Next
Thank
week
you,
we'll also
Patrick.
continue. We hope that by next week we'll have better news.
We hope we have better news. And people
more
are
recoveries.
Yes, more recoveries. People are
especially in Italy, a 101-year-old woman has survived.
Exactly, which is again like what I talked about last week. Hope. So exactly. So with our messaging and everything, be safe but stay healthy, stay hopeful. No fear, no panic, no anxiety. This too shall pass. Yes.
Amen to that prayer. If you are just joining us, we've come to the end of the program today. But I bet you that next week we'll bring you another exciting edition of this program. Don't lose hope. There is hope. We'll all pass through it. Just like Dr. did say, we'll pass through it successfully and face our lives as usual again. Until we come your way again this week, I said thanks for staying tuned and bye for now.
The quality and quantity of available housing stock in any country measures the development and quality of life of her people. On housing development, I make it my top priority to bring to you trending housing information and day-to-day housing plight of Nigerians.
If me as a civil servant working for my country cannot get access to housing loan, I don't know what else we can do.
Can you imagine that somebody will pay for 2 years rent and he's not sure of the next 3 months money in his pocket?
I also analyze the housing policies and strategies of government with stakeholders.
This issue is a journey of 1,000 miles. I don't think that anybody can pretend that we are going to close the 17 million homes gap in 5 years.